We're going to start this meeting with the Pledge of Allegiance, please. If everybody will stand. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. I ask Commissioner Williams if he'll give the invocation.
Thank you, Mr. Chairman. For those so inclined, please bow your heads in prayer. Lord, as we begin deliberations tonight, we ask for the spirit of wisdom to descend on us. We ask, Lord, that we listen at least as well as we speak. And in all of our deliberations, Lord, please cover us with a spirit of friendship and amity, all guided by your reason. Amen.
Amen. Okay, I hope everyone has had a chance to review the minutes from the last meeting. And with that being said, I'm going to ask if I can get a motion for the minutes of the last meeting.
Motion.
Okay, Margaret is a motion. Anyone a second? I second. All in favor? Say aye. Any opposed? Say no. Okay. Now, if you've had a chance to look at the agenda, I want to have a motion, asking for a motion for approval of the agenda today.
Motion.
Okay.
Second.
Ready? Margaret's a second. All in favor, say aye.
Aye.
Any opposed? Say no. Okay. Old business. Any old business? Janet's not here today. Anybody want to take over Janet for the director today? Okay.
I think the applications are under old business.
Yeah, I think the next item is actually under old business, the applications.
Okay. So we had our little committee meeting about the applications for new applicants for the board or new members. And at that time, we went over all the applications. I don't know if anybody wants to read those or review them, but the committee that was comprised of Brandy and Margaret and myself a couple weeks ago, I believe, we had a good group of professional applicants, and we felt that we would just go forward with all of them and send them to the commissioners for the commissioners to decide which ones were going to be on the board. So if there's no discussion, we'll go ahead on. If anybody wants to say anything about that, or any board members. So then I guess I would ask for a motion that we approve what the committee did for the applicants to become board members. And I'm going to make a motion that we approve those to send them to the commissioners. Okay, Margaret seconds it. And all in favor say aye. Any noes? So be it, then approved.
Okay, I am presenting this, and this is our State of the County Health Report. It is for 2023. It was due March of 2024, because of course we need a little time to gather the data and so forth. So, just want to remind everyone that and we call it the SOCH. The SOCH is done in the years between the community health assessments. So our last community health assessment was in 2022. So we had a SOCH in 2023. We'll have one in 2024, and then we'll be doing our CHA again in 2025. So what the SOCH report does is we talk about any kind of progress that we've made on our community health improvement plan. which is our action plan that comes out of the community health assessment. We also look at any changes in morbidity and mortality rates, any kind of emerging issues that are happening, any new initiatives, and then any paused initiatives. So I don't have a pretty report this time yet. We're going to be working on that, but I did want to just go over the findings. So in our first priority area that we came up with or we developed from our community health assessment was around affordable housing and homelessness. And you can see up here, part of what we do is we put together a result statement, which is like a vision statement for all people. Again, this is to look at, what do we want to see in our county around this area? And our Healthy Union Advisory Coalition actually worked on each of these priority areas. And this, again, is part of our Community Health Improvement Plan. You can see the result area, the result statement. I'm not going to read that out to you. And then around this area, one of our strategy was to hold a housing symposium with our ultimate goal was to increase awareness of the issue and really begin conversations about policy change and potentially strategic planning. And so we actually, as part of Thrive Union, which is a community partners coalition that really examines poverty issues in the county, we had put together a symposium and did that planning starting back in August of 2023. We were going to hold the symposium in February of 24, but ended up holding that symposium in March because of the election. Early voting opened on the 15th, so we pushed it back a little bit. I'm going to talk a little bit about some of the indicators that we see in our county, and part of what we're measuring each year and looking at, and one of the reasons we really picked this focus area. As you can see, there is a huge gap between what the median estimated hourly wage is for renters in Union County versus what you need to pay for a 2-bedroom apartment here in town. And so there's a really big discrepancy, and that just keeps getting larger as the years go on. This isn't a new issue, but it's getting to be worse and worse, especially with inflation. And we do 2024 numbers. I know that 2-bedroom apartment number is at over $29 per hour, and I do not know what that hourly rate is, but I know it's nowhere near that. Another indicator that we look at is the percent of cost burden renters and homeowners in Union County. So cost burden means that someone is paying more than 30% of their income on housing. And severely cost burden, which we didn't break that down in this graph, but there is data out there, it means you're paying more than 50%. And so you can see the lines here. The top line is looking at renters and the number of renters that are in this category. The bottom number is looking at homeowners, and the middle number, the middle line, I think it's in red or orange, is looking at if you combine both of them together. So you can see that a large percent of our renters, over 41%, are cost burdened. And one of the other indicators that we measure is the number of homeless in Union County, and got this data from actually the shelter. So I think it's at any point in time. Well, they also do a point in time study. So That's a little different. There's once a year where they look at the number of people who are in both in the shelter or unhoused, but these numbers here are the total number during that year that have been homeless in either the homeless shelter or unhoused in tent communities. We also have other data that we get as well. So it's increasing and has become, it continues to increase, which is certainly concerning as well. So, that's really what's happening, and I can tell you that we're, looking certainly at moving forward with the homeless and housing issues, just continuing to talk, hoping, again, to get that group back together, do some strategic planning in our community, because there's stuff we could be doing that we're not doing around that issue. And again, this is an issue that every county, every state, everyone is seeing everywhere. It's just continuing to get worse. Our second priority area is mental health, and you can see the result statement, our vision statement for the community. A couple of our strategies are up here around awareness and education, and then the other strategy is really looking at how we can improve the continuum of mental health providers in Union County. There's some programs listed here that we have in our community currently. And again, a couple of indicators that we are looking at include the number of emergency department visits, and we pulled out the 0 to 17-year-old population. And I did that primarily because, and I know this is really hard to see, but everyone should have copies of this. It is broken down into the total number of ED visits for that population, and then the number of broken down by depression and a few other categories. I think anxiety, trauma, and suicidal ideation, and then self-inflicted harm as well. So it's just startling, and I know that the rates are high for other populations as well, but they're not increasing in the same way that the 0 to 17-year-olds have increased. And then on the bottom is our suicide mortality rates in the county. So just talk a little bit about our progress. So we have this we had the same focus area in 2019 as well. So we've been tracking a bunch of information over time. So a couple things that we have seen is that we do a lot of postings on mental health awareness and education about different mental health disorders on our social media here at the county. Also, the school does some as well, which has been great, and so I get their numbers and we track that as well. Our behavioral health collaborative, who came here to speak, I believe it was last month or the month before. They saw over almost 8,000 students and served at the schools, which is big. We also have seen mental health first aid classes, and of course we would love to increase the number of people who attend that. And then our mental health crisis solutions team, which was led by Ashley here, we met to really look at the needs of foster kids who basically were getting stuck in our emergency room, and wanted to really look at what was happening and what we could do, and to identify the gaps in our community in terms of services and then potential solutions. So we met 7 times, and you can see the date range, and came up with those. And actually that group started meeting back up again. We started in March. We've met twice, and we are continuing that work and looking at what we could do with increasing services in our continuum. And then our third priority area is substance use disorder. And some of the programs that are listed here are newer programs that came out of our opioid settlement, from our opioid settlement funds. And I'm going to talk a little bit about some of the information we are tracking. We are looking at overdose deaths and emergency department visits, which and again, our data is always lagging a couple of years. Just remember that when you're looking at some of these numbers. The numbers certainly are decreasing in terms of the ED visits. They were increasing a little bit, but I believe they've dipped back down a little bit over the last couple of years for the overdose deaths. So some of the progress that we made on some of the, actually, that should say programs, not strategies, we actually got some funding from partners, behavioral health or management group, and we distributed out almost we're probably over this, 2,000 naloxone kits to 40 different community providers, which is huge. Our goal is to get those out into the community. We distributed out funds to 7 different organizations, and the opioid settlement money. Here at Human Services, we passed our tobacco ordinance. That was passed back the end of November by the commissioners, and we implemented that in February here. That was a mandate. We had to approve that in order to accept Medicaid clients. And then Wingate University has actually been working with a group here, and they've been developing logic models and tracking sheets and so forth for our opioid funded partners. And then there's another program that we're working on developing in the community, and that'll be a collaborative between the schools and law enforcement, behavioral health, and looking at 2 different clusters of middle and high school students. So right now, students are suspended when they are caught with substances, are suspended from school, and then they have to go to a class. And so we're looking at a different kind of model in the schools, and working on developing that program in the school, in those 2 schools or 2 clusters. So I believe it's the Porter Ridge and Sun Valley schools. And just to talk a little bit about what we saw in terms of morbidity and mortality rates, we have seen an increase in the Alzheimer's disease mortality rate, increase in Union County. It's increased everywhere. Do we know why? We don't know all the, we can speculate, but we don't know the reasons why that's happening. People are living longer, and there's better detection, and so that's part of it. Is there something environmental? We have no idea right now, so we don't want to talk about causation for that. I know that Ashley Burtz has come here and talked a bit about the case rate for gonorrhea, syphilis, and tuberculosis. So we've seen increases in that. We saw a very slight increase in heart disease mortality rate, but having said that, we've seen a lot of decreases over the years, so it was a tiny little spike. And then we've seen a decrease actually in overdose deaths involving illicit opioids, which is good. And one thing that isn't good here, and not that there's not a couple things that aren't good on this slide, but the mortality disparity ratio that we see between African American residents and white residents in terms of infant death is pretty alarming. So if you are African American, you are 4.82 times more likely to experience an infant death than white residents in the county. So that's something I know that our health department has looked at and has focused on, and will continue to focus on. A couple of new initiatives in our county. As you know, we've been going through Medicaid transformation here, so that's something that has impacted everyone, and yay, we're happy about that. We've had both rabies clinics for both animals and for humans, which and we're gonna. I believe we have another one coming up soon. Saturday. Yeah. Okay. And but we did a couple of them last year, and they were really successful. So we will continue to provide that. We've been doing more STI screenings and outreach in the community because of the rates being so high. We worked with the schools to help them implement new tobacco curriculum. And they did that for, I believe it's in 6th and in 9th grade so far, which has been great because, again, I think I've talked about this before, but the tobacco curriculum that they had in the schools was from 2012. So it didn't have anything on vaping, but now it does. And so that's exciting. And then we have really worked on increasing vaccination access. We've brought our mobile unit out into the community, so in those historically marginalized areas, and that's really important. And in the environmental health area, I'm not going to even pretend to know everything about this, but I do know that Tracy has talked about these programs here before. So a few of the new initiatives have been the Clean Classroom for Carolina Kids program and the baseline well water sampling for PFAS. And I do remember Tracy talking a bit about that at our last meeting or the one before. And then some emerging issues that we are seeing, just the increase in substance use disorders in general and behavioral health needs, the increase again in STI cases. We are seeing or have continued to see an increase in vaping products, vaping use among youth. And I know in talking to the schools, it is a huge issue that takes up a lot of time for the schools on a daily basis. We, again, have seen the impact of affordable housing, but also have seen that on health outcomes. And we, I know that our county childhood vaccine immunization rates were below the benchmark, but higher than the statewide average. And I believe that that's gone down for everywhere across the state. And we've seen an increase in the number of illegal food vendors, and again, that's something Tracy's talked about, and an increase in the number of contamination of food, spices, etc. And again, I know that Tracy's talked about those as well. And some of our paused initiatives in our county include the COVID the COVID reporting that we were doing here in the county in 2022 was stopped, and there were different initiatives on the state level, and then the on-site wastewater disposal system repair program was paused. And I believe that's what I have. The report will be out. I mean, I have a copy of the report, but it doesn't look very pretty because of the format that the state has us using. So I want to wait until it looks a little nicer to get that out to everyone, and I'll bring them here. I don't know if anyone has any questions.
Well, thank you, Stephanie. And I know that it's a hard tackle when you talk about that housing situation, affordable housing. And I was listening to the news some time ago about what Mecklenburg County was doing and how the government was involved somewhat. And if we're ever going to get anywhere, I was just wondering, has there been a connection with the commissioners and housing that particular issue, the topic? Because otherwise, I'm just wondering, where is it going to go? It is bad. I understand it's all over the state, all over the country, actually.
Yeah. So that housing symposium that we had, we actually invited county officials. I believe Commissioner Williams was there, and we invited all the municipalities, because really a lot of the initiatives need to come out of the planning department. It needs to come out of doing something. Mecklenburg has a very big strategic plan around that it's pretty comprehensive and has taken a long time to do. I know I've talked a bit to Clayton, who's one of our assistant county managers, a bit. So I know that they're was an application that the county put in to do a needs assessment and to look at this a little bit more. I'm not sure if they have heard back from that, and it was a pretty big grant that they applied for. But we definitely want to make sure that everyone is, that we're continuing to have those conversations. So, the Thrive unit has been reaching out also to the municipalities, trying to get with the different planning departments. So there's still a lot of legwork that needs to happen. But, in terms of getting in front of all the commissioners, we haven't done that as a whole, but we certainly can do that.
I have a question on that. One, do we know what our percentage of chronic homelessness is for the percentages that we are seeing on that?
I know Melissa has those, McCowan, but I want to say it's really low here in our county. So when she did the presentation, I believe it was somewhere around 15 or 17%, which again is really low. So a lot of the homeless people that we're seeing are families, some that have never been homeless in the past. And again, we're seeing people who are people on fixed incomes, so people, older folks, people on disability, people that just, what's happening is landlords are increasing rent, and there are lots of different reasons why. And then people can't afford it. And so again, that disparity between, what people make and what is available is pretty significant.
And those would be low percentages. Those would be considerably higher than where we were in 2022 at 13 something. But I guess I asked because you said in 2024 that we know that the estimated wage needed was around 29 now, right? When this was 25. But yet we already had a $9.19 discrepancy.
Yeah.
So I don't think that the wage is over 20 in union now.
No.
We're definitely in double digits now.
Yeah, I believe so.
Increasing that number.
And, just to put that in perspective of a salary, it's about $62,000 a year is needed for a 2-bedroom. And, if you look at the salaries of some of our teachers, our first
staff.
responders, some of our staff, childcare workers, they're all well below that. So, I know a lot of times people point to people in poverty or homeless population, but we're talking about people who work full-time but just work at jobs that don't pay a whole lot and are out there. So it is tough out there.
Yeah, that's why our chronic is low, because we're going to see an increase. It's working poor.
Right.
The other thing was on the suicide mortality rates. We don't have anything since 2021 on that still?
I think the 2022 just came out.
Okay.
Yeah, they're always lagging, and sometimes they're lagging a little bit more in 2 years.
There was one more.
And state data.
Pardon?
It comes from the state.
Yeah, and I thought there was one more actually. On the ED visits for opioid. Do we know where we came in last year for the total ED visits? I know.
I'd have to look it up. I think that we probably have to have that information. I just don't have it in front of me.
Okay.
Yeah.
But you think it was a decrease in the illicit?
I do.
Okay.
We're definitely seeing decreases in that area.
Thank you very much.
Any more questions for the board members? Any more questions for Stephanie? Okay, let's go to the next report.
Oh, I'm sorry. I thought.
Ms. Tracy.
Good evening, everyone. I'm Tracy Colley with Environmental Health. Just wanted to present several fees to you this evening. for your support and consideration. 4 of the fees are associated with the on-site water protection program, an increase in the improvement permit application, both for residential and commercial, an increase in the cost for the existing septic system inspection, and then also a slight increase in the fee for the well permit. And then the next set of fees are related to our public swimming pool program, fee increases for plan review, both for very large pools, something on the order of like the Monroe Aquatics and Fitness Center, and for other public pools, such as those that serve apartment complexes and neighborhoods and that kind of thing. An increase also in the seasonal operations permit for a pool, and also year-round operations permits. And then finally, just an additional increase for the reinspection of public swimming pools for visits that we conduct when a pool is not ready for permitting. Does anyone have any questions about those fee proposals?
And Tracy, these fees are just to keep up with the expenses, is that correct?
Yes, sir. That cost of doing business, cost of staffing, cost of supplies related to water sampling, and just everything we do.
In that case, I would like to make a motion that a motion to approve them all in one, all together as one. Approval is my motion. Got a second from Amy. So all in favor say aye. Opposed?
Thank you.
Okay, approved.
July 1st.
Okay, in keeping with fees, we have some clinical fees that we are also proposing to increase that are as part of our budget preparation that is being submitted to the commissioners for fiscal year 25. This is really in 2 different buckets, so to speak. The first one relates to general clinic fee adjustments that we're requesting, an addition of 21 new fees that are basically related to some behavioral health and psychotherapy services that we're looking to implement in our child health clinic as part of a pilot collaborative care model to try to integrate patient-centered mental pediatric health services. So that's those are some fees that would be associated with that. The remaining 14 fees are adjustments are existing clinical service fees that are below the current Medicaid reimbursement rate. And so by raising those fees, we're able to maximize our Medicaid reimbursement revenue. And in establishing our fees per policy, we typically set them at 30% above the Medicaid rate. So those are our general clinic adjustments. And in our dental clinic, we're requesting to increase our dental clinic's fee schedule 5% across all procedure codes. As a safety net provider of dental care for residents who have difficulty accessing needed care, we're very sensitive to keeping our fees at reasonable levels and are typically well below what you see in the local dental care market. About 63% of our patients are on a sliding fee scale and typically slide to 60% of charges. Our costs for providing the services continue to increase each year, as you heard Tracy mention. Supplies, equipment are all costs that do go up. This adjustment helps offset some of those increased costs. The projected additional revenue from the fee schedule adjustment for the dental clinic is around $11,000, just a little over $11,000. And we feel this is reasonable and will not present a significant hardship for patients or deter their care. So that is what we have submitted to the commissioners as part of our budget package, and would entertain your approval.
Dennis, could I just ask you, I may have missed when you said you try to typically keep your fees, which fees about 30% of the over the Medicaid rate. Could you just elaborate on that a little bit?
Yeah, it's one of the things we want to make sure is that we're able to generate what the Medicaid rate reimbursement is. So you want to have your fees at least what the Medicaid rate is, if not more, because if you're under that, they're only going to pay you what your fee is. So you want to at least have it at that. Occasionally, you're able to get commercial insurance that may pay more for Medicaid, so more than Medicaid rate. So if we did see that, we don't have a lot of commercial insurance, but if we did see that, having it a little bit above the Medicaid rate, we're able to then realize that particular revenue. But as I mentioned also for things like dental and our fee structure in general, we want to keep it reasonable as well, because if it's a fee that slides, you don't want it to be astronomical, that it presents a burden. So that's sort of a standard in terms of how we set that. We also look at the cost of service. For any of our codes, particularly in our clinical services, annually there's a cost reporting process that's done as a part of our Medicaid cost settlement process, which looks at what the cost per service is, looking at salaries of the staff who are involved in that service, the time. It's a fairly involved process. We want to make sure that the fees that we're charging are certainly not that we're not having fees that are out there beyond what it costs us, and clearly our costs are more than what our fee schedule is.
I do. When it says that existing fee, yes or no, right? The majority of them under the medical were no, but then there's a list of the yes. So the ones that were no, we didn't previously charge for those?
No, we didn't have those
We didn't
fees
have
on our
those.
schedule.
Okay. And then, so if someone is uninsured, their rate is the 30% above Medicaid?
It would be, if it's going to slide, it would be based on what their eligibility would be, and if they slide to 60% or 40%, it would be what that rate is of our rate.
Okay.
If that makes sense. It'd be,
And then 3 of them don't slide, including like varicella?
Right. And some of those are because we participate in the state's children's vaccination program, and some of those we're not able to slide those costs.
Okay, thank you.
Any other questions for Dennis? So I'm going to give a motion for approval. Okay. Dr. Weiss has made a motion for approval. Any second? All in favor say aye. Aye. Any noes? Okay, it's approved.
Okay, the next item I'll cover pretty quickly. You have a packet of information in your packet on roles and responsibilities for boards of health. A lot of this is sort of driven by the fact that, as I mentioned earlier in a couple meetings ago, that we're in the process of our accreditation process for local public health. We will be having our site visit in October. We're preparing all of the documentation efforts now and pulling pieces of information together. This particular PowerPoint that you have really describes the various roles and in relationship to sort of accreditation. I'm not going to go through it all because one, we're going to have a lot of new board members that are going to be joining us before long in the coming months. Additionally, we are also going to be working with the School of Government to arrange some protected time for training to come out and do a presentation and training on the roles and responsibilities for boards of health and Human Services Board. I mean, when you see Board of Health, the accreditation that we're required is for local health departments in North Carolina. As a consolidated human services agency with a consolidated board, the Human Services Board takes on the roles and responsibilities statutorily that are assigned to local boards of health in North Carolina. So when you see something that refers to Board of Health, that's you. So just to clarify that, it's synonymous with Human Services Board in a consolidated model. So we thought it would be good to actually have, instead of just listening to me and Ashley and other division heads talk about an orientation with new board members coming on, it would probably be good to have some training with the School of Government for one of our upcoming meetings. And so we're in the process of looking to schedule that. Looking at, what can the board do, what you can't do, what's, that whole 9 yards. So I'm not going to go through this. I would encourage you to review it because there are a lot of pieces of information in there in relation to our accreditation process that is important for you to be aware of. And also it puts some things in perspective as to why you'll get certain kinds of information brought to you, such as fees or other things, because those are things we need to get your approval to advance them further to the county commissioners. So unless there's any questions, we'll close with that.
Thank you. I think that's a great idea, Dennis. And we look forward to that. And so you said in October, you have a site visit. So
Yeah.
when do you expect for this School of Government? They'll come to a presentation?
Well, it could be, I know Janet had mentioned June, possibly August, one of those. We normally don't meet in July, or excuse me, y'all normally don't meet in July. So there's time. It's a matter of getting the instructors from the School of Government, the schedules all arranged. We would try to do it in conjunction as part of one of the regular board meetings.
That sounds great. I would look forward to that. Thank you so much, Dennis. What's next? So, okay, well, no more presentations, so I guess we're in order or ready for our division reports.
Since I've got a, okay, we'll go.
Shit. I'm on. The only update I have today is I just wanted to let you all know that many of you saw the procession that came through Monroe earlier today. Sam Peloche's wife, CLO, works for Union County DSS. And so myself, a lot of the staff, I saw the county manager, one of the assistant county managers, and Commissioner Rao was at the funeral today. It was one of the most moving experiences I've ever attended, and I just wanted everybody here to know how incredibly proud I am to be from Union County, and it was just amazing watching the outpouring of support for the family, so just wanted to share that.
Well, thank you, Ashley. Anything else from social services?
Negative.
Okay. Who's next?
Hi everyone, Veteran Services. First of all, I want to apologize that I can't make a lot of these meetings. I do have a conflict on this evening most times, if that makes sense. We're doing really well at Veteran Services. We just had a really nice event at the theater. That was a documentary that had a pretty good turnout. I was pleased and excited that the City of Monroe and our Union County management team pushed that event. It was very nice. We are fully staffed. We were vacant for about 6 weeks of an admin, and now we've got our admin filled back in, so we're fully staffed and rocking and rolling.
thing I have is just to remind folks that you got in an email that Carla sent out last week, I believe. It was a follow-up piece of information from our last meeting that spoke to when we gave the child fatality prevention team and the community child protection team reports. There was a question, I think, that Mr. Ford had asked about some of the racial breakdown of the deaths that we had seen during that year of review. So we just provided that and just wanted the records to reflect that information being provided.
Thank you. Okay. Tracy?
The only thing I'll mention is last month we had our food safety class for restaurant managers. Very successful. It happened actually here in this room. And we had our best pass rate yet at 93%, which is excellent. So it's a great way to promote food safety in the food service industry. So really proud about that. We do have retirement. David Finley, who is currently the on-site water protection supervisor, very important position within our division, is retiring on May 31st. We have named an internal candidate to take that position, so we're excited about that. But sad to see David go. He's done an amazing job. That's all I've got.
Thank you, Tracy.
Yeah, I've got one more thing, and it just dawned on me when you're talking about things that's leaving. As many of you know, inmate health is something we were looking at transitioning over the past really about 9 months of doing that. And so today actually marks the first day that the health department is not responsible for carrying out inmate health services. The new vendor is Medico. They do correctional health work, and a lot of work has gone into this transition, and I want to thank the county for the assistance in that particular transition. Fortunately, I think all of the staff that wanted to remain with the county, we were able to align them and get them on board with existing positions that we had in terms of some of the nursing staff that we had. Those that wanted to stay and remain were able to do so with the new vendor, and there may have been one or two that chose other places that they wanted to land, but just wanted to make folks aware that we're, as a health department, no longer, we were the last public health department in North Carolina still doing inmate health, and so I guess that's a little history making now, isn't it? But anyway, I want to make you aware of that.
Thank you. So we got Teresa and Stephanie down there. Don't want to know. Okay.
We just have the rabies clinic Saturday, so if your pet needs to be vaccinated, bring them on by. Keep them in the vehicle, but bring them on by.
Okay, I guess that's it. We want to ask the commissioner, any words you want to give us of wisdom, Commissioner, about what's going on in the county?
Yes, thank you, Mr. Chairman. I do have an update. At our last meeting, I had mentioned that Partners Behavioral Health, on which I'm the county's representative on the board, was in the process of searching for a new CEO. And I'm here to report happily that the board interviewed multiple candidates, 3 candidates specifically. We got it down to 3 candidates. We interviewed an internal candidate, 2 external candidates. We exercised, I feel like, our due diligence and duty of care. And I'm happy to report that the Partners Board, in a special meeting last week, hired Elizabeth McCraw, Libby McCraw, many of you know, and she is the current COO, Chief Operating Officer, and she will be taking over as CEO at the end of July. And we expect our outgoing CEO, Rhett Melton, will be there with the transition and maybe even consulting for a period afterwards. But I just wanted to share that news, and that We feel very confident in Libby, and this is a period of, I think, extraordinary opportunities and challenges for partners. We're fixing to double our revenues from this fiscal year to next fiscal year with Medicaid expansion, with moving into tailored plan management. So the challenges are big, but the opportunities are big, and in short, I think we've got the right lady for the job. So how about that?
So that was the good, what's the bad, Commissioner?
Oh, well, nothing bad other than
Challenges,
some real
I should say.
challenges. I mean, and I'll
Challenges.
just be frank with you. I love working with partners because I feel like, I mean, they do a great job, but more than that, they occupy this special space on the healthcare landscape. They have the best from a private entity, but they also are fixed on kind of public service. They're this unique entity created by statute, and I think it's served the state well, honestly. But we're heading into a period where the competitive landscape is going to get intense, and there are a lot of standard plan and commercial providers that will be competing in this space. I feel like Partners is positioned to continue to deliver on its mission and serve our 15 county area well, but it's going to be challenging. And Partners can't do some things that some of these standard plan providers can, which is write big checks to political campaigns. But we have other advantages. So the competitive landscape is changing. It's getting more intense, but I feel like we've got the right leadership, and we've got folks on Jones Street in Raleigh that appreciate the place that we occupy in that landscape and want to see us and succeed and continue to provide great care. So I wouldn't say that's bad, but it's a challenge. So.
I would second what you just said about Partners. I do think that of all the MCOs, they're doing a really good job. I also think that they oftentimes serve some of the most complex of the individuals. I'm a fan of our I options and our expansions, and I think that that's a big selling point if you have a complex individual that they need to know if you take one of those other plans, you don't get that, right? And so those respite hours and community living supports are something that only Partners can offer you, if those are needed. And also, they do a great job with state CFAC and representing, and really bringing up tough issues and bringing those to legislators. And so, I would also be a fan.
Well, thank you. I think everybody here. Does anybody else have any more information they want to put on the table or put forth? Well, with that being said, I'm going to ask for a motion to adjourn.
So moved, Mr. Chairman.
Anybody second?
Second.
I'll stay here a little longer, huh?
Second.
Okay, all approved? Say aye.